Hello and welcome to Polly's podcast. Thank you so much for joining me. All right, so let's get started. Today we're going to talk about a very controversial subject, a subject that most doctors avoid, especially on the internet. They avoid it. They don't want to get caught talking about it because, they don't want to get in trouble. But I really do wish that they would be a little bit more honest. And I don't think that's ever going to happen because there's no money in honesty. So today I'm asking this question: is cancer an inflammatory response? And I want to have a thoughtful conversation about inflammation and diet. So again, I welcome you to Polly's podcast. Please subscribe. It's free. Today we're exploring a deep and very important question, one that requires curiosity and responsibility. So, if obesity is associated with inflammation, if injury creates inflammation, and if inflamed joints improve when inflammation is reduced, then could cancer also be connected to inflammation? And if so, can diet play a role in influencing that process? If this subject interests you, stay here. Let me know in the comments below why you're staying. This is not medical advice. This is a conversation about physiology, about metabolism, and about how the body responds to stress. So let's walk through this carefully. Inflammation is not always the enemy. So when you cut your skin, it's an inflammatory protective response. So it brings immune cells to repair that tissue. So when you sprain a joint, inflammation increases the blood flow to begin the healing process. So acute inflammation is intelligent. It's temporary and it resolves. The problem with inflammation is that it begins when it becomes chronic, low grade, persistent, nagging, unresolved. So chronic inflammation is linked to obesity, insulin resistance, cardiovascular disease, joint degeneration, and yes, even certain cancers. But we must be a little bit more precise. Okay, cancer is not simply inflammation. That's not all it is. It is cellular growth that is influenced by gene mutations, environmental exposures, immune function, metabolic signaling, and inflammatory pathways. So inflammation, yes, is often involved, but it's not the whole story. There's more to the story. Like adipose tissue, especially like visceral fat, is metabolically active. It acts as a hormone of its own. It releases inflammatory cytokines. And I know you've heard this word before, cytokines, because you heard it during COVID-19, you heard it about the vaccines. So this creates a systemic inflammatory environment. In obesity, insulin levels tend to remain elevated. Blood glucose, blood sugar fluctuations increase the oxidative stress. Inflammatory signals rise. So yes, obesity is associated with chronic inflammation. And when individuals reduce their visceral fat, improve their insulin sensitivity, and lower inflammatory markers through diet and lifestyle, we often see improvement in joint pain, in energy, metabolic markers, and overall health. That connection is well established. Now let's discuss cancer carefully. Cancer development involves multiple steps: DNA damage, cellular mutation, failure of immune system surveillance, and abnormal growth signaling. Inflammatory pathways can contribute to this environment. And if you take anything away from this video, this should be it. If nothing else resonates with you, this. Chronic inflammation increases oxidative stress. It can also alter cellular signaling. It may promote angiogenesis, which is the growth of new blood vessels that tumors use to grow. So in that sense, inflammation can support tumor progression. But cancer is not simply just an inflamed wound. It is a complex, multifactorial disease involving your genes, your body's genes, not your familial, not your family genes, your genes, metabolism, immune regulation, environmental exposure, and sometimes random, bizarre mutation. So the better question is not, is cancer just inflammation, but rather, how does chronic inflammation influence cancer risk and progression? And that's where diet enters this conversation. Diet absolutely influences inflammation. Excess refined sugar, highly processed foods, carbohydrates, industrial seed oils, chronic overconsumption, elevated insulin levels, all of these are associated with increased inflammatory markers in many, many, many people. On the other hand, proper food, proper proteins and fats, adequate amounts of proteins and fats, stable blood sugar, healthy body composition, omega-3 fatty acids, micronutrient sufficiency, macronutrient sufficiency, these are associated with lower inflammatory markers. So when people change their diet and notice reduced joint pain, improved metabolic health, or better and faster recovery, that reflects shifts in inflammatory signaling. That does not mean that diet alone cures diseases, but it does mean diet has a huge influence on the internal environment in which disease either thrives or struggles. And here is where we must be careful. Sorry. My little dogs. There is... Okay, Micah, thank you. Thank you, Henry. Okay, so here is where we must be careful. Micah, please stop. Stop. There's ongoing research into metabolic therapies, insulin signaling, ketogenic interventions, caloric restrictions, anti-inflammatory dietary patterns, and some evidence does suggest that certain cancers may respond to metabolic shifts. But cancer treatment should always include and involve medical professionals, like an oncologist, a doctor, or at least evidence-based care. Whether it's holistic, whether it's all natural, no matter what your choices are, should be evidence-based. Diet may support metabolic health. Diet may influence inflammation. Diet may improve resilience, but it is not a replacement for the type of care that each individual really needs as a therapy or as a treatment. Look, there are natural treatments. There are natural therapies. There's holistic, there's orthodox, there's many, 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 many. There's not just one way of doing things. There are many ways of doing things. The responsible statement here is that optimizing metabolic health may reduce cancer risk and may support the body during treatment. But cancer is not simply reversed by reducing inflammation. There's other things involved. And we must respect the complexity. Inflammation is protective only until it becomes chronic. Obesity is associated with systemic inflammation. Chronic inflammation contributes to many diseases, including some cancers. Diet plays a powerful role in shaping inflammation and metabolic health. But cancer is complex. It is not merely an inflamed joint or an inflamed injury. The internal environment matters. Your internal environment. Your metabolic health matters. Reducing chronic inflammation matters. Not from a place of fear, but from a place of stewardship over your physiology. We're going to dive into this deeper again in another episode. So make sure that you're subscribed, okay? Hit that notification bell for me. And if you think this episode will help somebody that you know, that you care about, please share on all your social media platforms. This is a new channel, and it will really help us out a lot, help you and me. Stay curious, stay thoughtful, always seek wisdom, humility, and I will definitely see you in the next episode of Polly's podcast. All right, where are we here? So until next time, toodles.